Are there any patients where it is dangerous? If there's something wrong with their heart muscle, or is there anything that can make this more dangerous and we should really worry about it a lot more?
Right, and that's one reason that we need to do some investigation when we're working these rhythm problems up. The first thing is to determine the type of fast heartbeat that it is from the recordings that we can get during an episode. And then the other part of it is to determine by physical exam and the rest of the history and possibly an ultrasound of the heart that the heart muscle itself is normal and that the heart is put together structurally normally. Okay.
So I guess I need to decide whether or not, since this has really just started happening, it seems like maybe we should try some medicines first. What are the different kinds of medicines that I could try to control these before sending my patient to have a more invasive procedure time?
Yeah. Well, of course, we always start with the medicines that are the least obnoxious for the patients, so that you don't have much risk of any serious side effects or any annoying side effects. So there's two of those, and so assuming that the EKG, which you've done in your office when you first saw the patient, I'm sure, is normal, there are really two equally good choices to start with. One is called a beta blocker, which tends to just slow the heart rate down a little bit and keep you from flipping into it. And a calcium channel blocker, which is like verapamil, which does a similar thing, and it just tends to, if your heart rate tries to start going fast, it will not be able to make that circle completely and can keep you out of it. And both those medications tend to be well tolerated. The beta blockers are a little more likely to cause some fatigue. In some patients, the verapamil could cause constipation. That's really about the only side effects that we worry about with those two. Mm-hmm. So those are good places to start.
And would you say most people respond to those two medications?
Most people do, but you know, it's hard to get absolute control without giving them a lot of the medicine, and that's why some people end up choosing to go the ablation route.
Mm-hmm. Okay. Is there anything else I should know about this arrhythmia before I make a decision about the best way to treat my patient?
Well, I think it's a very individual decision, and I think that it really requires the involvement of the family, because when we try to make the decisions for them, we don't necessarily know what the dynamics are, how much it bothers the kid, how much it bothers the parents, how much they hate taking medications, how likely they are to take their medication. So you have to, I think you just have to put all those things, all those factors together in deciding. Some people, this is really not an issue for them. It doesn't bother them very much. It's not very fast. It doesn't happen very often. Other people, it's really ruining their lives, and that's why I think you really have to find out how much this is affecting their life.
Well, my patient's 10, but she's really skinny. So how small can you do this? How big do you have to be to have this done safely if we want to do the procedure?
10 is certainly big enough. I find that more of my patients are ready for it when they hit the teenage years because they're old enough to talk their parents into it. Because oftentimes the kids are ready before the parents are for the ablation. But I've done it in children as small as 3 or 4 years of age. I think that, you know, once you get to be about 50 pounds, there's not a big difference in the success rate between the smaller kids and the older kids.
What is the success rate?
The success rate for the ablation is somewhat dependent on the exact type of the fast heartbeat, but in general it's about 90%. Some types, I can tell the patients going in that it's more likely to be 95% or more likely to be 85%, but for the average patient it's about 90%.
And then how risky is this?
The risks are very low, and it has to be because we're doing this procedure on patients who are really otherwise very healthy and they have a non-life-threatening condition. So it makes no sense at all to offer them a dangerous procedure. That said, of course, there can be some risks of any invasive procedure. I think the main thing that kids like to know is that they'll be asleep while I'm doing it, and that there's no stitches or big scars that they're going to have to deal with afterwards. We go in from the leg vein. It's just like a poke through the skin after it's been numbed up and after they're asleep. So from that standpoint, it's a very comfortable procedure for them. As far as serious side effects go, I do always talk to the families about that and emphasize that in very rare cases, there can be a risk of damage to the normal electrical system of the heart, so that we have to map out carefully where the normal electrical system is and avoid damaging that. There have been people who have needed pacemakers after the ablation because of damaging the normal system. Not in my experience, but in other people's. So there can be problems like that.
My patient really likes to play sports. How long does she have to wait after this procedure before she can go back and ride her horse and do all the activities she likes to do?
4 days.
4 days.
Yeah. They really could probably go back after 2 days, but I like to give them another day or two just to let the leg heal up a little bit more.
Anything else I should know before I make recommendations to my patient that I haven't asked you?
I can't think of anything. You've asked very good questions. I think most people find that taking medication is okay for a while, but then they get tired of it, and that's usually when they choose to go ahead with the ablation. They've tried it, they've thought, well, maybe it'll go away, let's just take medicine for a year or two and see, and then if it doesn't go away, then they're ready for the ablation. So I think that's probably the most common scenario, is they'll try the medication at first, and if it's going fine, they may stay on it longer. But if it's too hard to take the medicine, they keep forgetting, or they go into it anyway, then they'll come to me and say that they're ready for the ablation.
Great. Good. Well, thank you very much.
It's my pleasure.
Hi, if you're watching this, you have an arrhythmia and are considering a catheter ablation, or you know someone who is. I had the procedure done 2 years ago, and I would like to reassure you that everything will be okay. It probably feels scary now, but it's so worth it because I think that it's the best decision I ever made. If you have SVT or another arrhythmia, then you know that it's more than just an annoyance because it interferes with your whole life. Getting a catheter ablation might be a hard decision for you, but I think you should get it done, and you can trust me because I know that having an arrhythmia isn't just an annoyance. It's something that weighs you down and makes you worry about things unnecessarily. Thank you for listening, and I hope this has made you more comfortable about getting a catheter ablation, or at least has made the decision easier.